Welcome aboard. Put your seats in the upright position. I don't even want to say extinguish all cigarettes, right? That's past, right? Or do people still smoke?
Joy 99.7 FM.
Right. We've been moving with the mental health team, Department of Psychiatry, University of Ghana Medical School, Department of Psychiatry of the Kolebu Teaching Hospital. We've been marking our week and we've been prioritizing mental health. Last week we tiptoed into substance use and addictive behaviors with my guest, Dr. Lorna Latte, a resident with the department, and Sami Jando, a mental health practitioner and an addiction specialist. So today we're going to go into the nitty-gritty of treatment management. Where do you go if you have a substance use problem? How do you know if you are substance involved or substance entangled on that maladaptive level, right? Sami and Lorna, you're welcome.
Thank you.
You don't pick my vibe. When I play music and things, I'm trying to get you addicted.
Sure. The film is there.
The film is
Thank
there.
you.
Yeah. We've had a great week, right?
Yes.
We've had a keynote presentation by Prof. Angela Ofriata,
Yeah.
right? Telling us that the country stands the risk of being at least 7% down by way of GDP, right?
That's
Yeah.
huge.
Due to mental health challenges.
Yeah.
Okay. And we talked about quite a lot of things. We talked about the mental health of the elderly, and we got into substance use. And we emphatically said last week that when you take a substance, you have altered manufacturer settings.
Yes.
You change the neurochemistry of your brain, and it affects your brain, your body, and your behavior. But we'll hit on some of the key points.
Sure.
We're hoping to be joined at some point by Dr. Grace Owusu-Abuaji. She's a clinical pharmacist with us at the department, and hopefully she'll join us to also shed some light on substance use and addictive behaviors. So, Sami, last week we learned that if you use a substance to the extent that it compromises your ability to handle your regular day-to-day obligations,
Yeah.
right? Makes it difficult for you to handle those things, and then it starts to compromise your capacity in any way, relationships, work, academics, etc. Then you do have a problem that we should be looking at. Am I right?
Yeah, that's exactly the point. And then we have so many things that could show that you have addictive problem.
Okay.
And then one of such is the withdrawal that you go through when you don't use it for for some time.
Okay.
Your body goes into what we call physical and psychological withdrawals, where you crave for the substance and you become restless. You cannot eat. You cannot sleep well. You are easily irritable.
So without the substance
yes.
or the behavior, the activity, you are uncomfortable.
Yes, because now your brain has been hijacked by the substance or the behavior that you are consistently doing.
Okay.
So in the absence of it, the brain is craving for that substance to be
Right.
able to function in that capacity.
Right.
Yeah.
So you are deficient in the absence of the substance.
Yes, exactly.
This was not the case before you started playing games with the substance.
Yes.
Right.
Yes.
It's an acquired phenomenon. Right.
Yeah.
It wasn't the case. Your brain could function. You used to be okay without it. Now you are dependent.
Yeah.
It means your system needs it to function normally, in
Yes.
quotes. Okay.
Yeah.
So you've created a new normal, which
Yeah,
requires the chemical action of that substance on your nervous system for you to feel okay.
Exactly. That's the point.
Okay. Now, I'm aware, you know, that sometimes when we're looking for telltale signs to show that you are dependent or addicted, we look at your attempts, typically your failed attempts and efforts to stop or self-regulate, right? The typical person who is dependent or addicted has struggled. They've come to that awareness that I have a problem with internet porn, or gambling, or cocaine, or alcohol. So they try to cut down. Why is the failure of these self-motivated efforts a critical indicator that you are in trouble?
Well, because now your brain is dependent on a substance.
Okay.
It's a clear-cut sign that you cannot function with a substance when you try to stop using a substance and you are unable to. I mean, some people will be able to tell you that they confidently stopped for a month or 2 months. Yes, they were able to stop it on their own for a month or 2 months, so they feel like there's no problem.
Okay.
But the issue is, even within that 1 month or 2 months, they were still having these cravings.
Right.
There was the psychological dependence that they were having.
Okay.
So in the time that you're able to stop on your dependence, it's just you were able to do away with the physical issues a bit, but a lot of the time they still have to battle the cravings, which causes the failure in the end.
So it's a key indicator. We look out for it.
Yes.
So it's like telling yourself, okay, I'm buying too much of this telco's data. I want to cut a quota for myself. I'll buy 5 CDs of data. But I find time and time again that I exceed that 5 CDs and I'm struggling to regulate.
Yes.
Okay. In the same way, I may say that I've stopped or I've limited my alcohol use.
Yes.
But over time, I find that I breach
all the time.
I breach all the time.
You breach all the time.
Okay, all right. 13 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. By now, you should be addicted to this program. You should know what we do on a Sunday afternoon. And I don't mind if you get into withdrawal because it brings you back. We're talking with our guests about the implications, the import of substance use and addictive behaviors to the point that it is maladaptive, it is harmful. Right?
Yeah.
And we're going to be tiptoeing into kind of management strategies and support out there. So if you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and we want to hear from you. Any confessions and testimonies? How have you managed your own struggle? Right? One of the big things I'm going to throw to Lorna and Sammy is this issue of denial. Right? Some people convince themselves that they are in charge. Oh, this is, I don't have a problem. In fact, when I want to switch it off, I switch it off. How big a problem is denial when it comes to substance use and addictive behaviors?
It's a very big problem. It's what would say accounts for most of the difficulty in getting into recovery in the first place.
Okay.
A lot of people tend to, it's the idea that because the first use was an individual decision.
Right.
At that point, it's difficult to understand that your continuous use is no longer an individual decision.
Right.
There are people who understand this all right, but it's difficult to say that you have reached a point where you cannot do it on your own and you need help.
All right.
So in that instance, it becomes difficult to reach out to get help. It's a big impact it affects
something
how
we have to address when we are doing
to
therapy.
Yes.
But let me play the devil's advocate here, Sammy. I mean, come on. I take a couple of bottles, right? Don't worry about the content, but I take bottles, right? And I drive home, all right?
Sure.
I go to work, all right? Okay, a few people notice or comment on my drinking, but by and large, I'm fine. It's my money, and of course, I'm past the age of 18. So why do you call this denial? Why is it a problem?
I think lack of education about the effects of the substances on the individual also account for this denial. Because there are a lot of people who do not think that it's a disease that needs treatment for. So they think that they can just snap out of it at any time. And then, oh yes, today I took it, and in the next 5 days, I've not taken it. So meaning it's not going to be a problem. The problem comes in when you can't control yourself anymore. So they see the people that are problematic as people who are on the street, people who just wake up in the morning and that the only thing they think about is alcohol or any other glasses. But they don't know that there's other distraction that is being done to their body, their brain, and their what do we call it, association with people, and that is where the problem is. And since we talked about motivation the last time, and then how the brain is wired and how it is hijacked in one way or the other, these people will say, let me say, they have been demonized. Let me use the word. Yes, by the use of the substance.
Right.
So they have no feelings, or they have no critical thinking ability to be able to restructure themselves or to get themselves back into normal.
Great. 17 minutes past your 2 on Joy 99.7. We're delving deep into the phenomenon of substance use and addictive behaviors. These days, people are into all sorts of things: gambling, patronage of porn sites, compulsive online shopping, some forms of virtual online voyeurism. They are peeping and looking at all sorts of things, and they're starting to get a thrill, right? It starts accidentally, on purpose, in quotes, but now you are actively seeking this thing out, and it does something for you. And we are suggesting to you that it has changed your body chemistry. It has changed your behavior. In a sense, you are addicted to your phone. It may not be a physiological or physical addiction. When you don't have your phone, my goodness, you go searching for it, and you can see the dependency there. So that's what we're talking about, these kinds of behaviors. If you have any concerns, questions, experiences, testimonies, 055 11 11 997. I'm told there's a problem with our YouTube feed, but we're live on Facebook, and shortly I will also activate the phone lines so you can talk to the mental health practitioners in the studio. Okay, so this is something we need to get to understand. I'm using the substance. It has breached my control. Last week I talked about the 3 C's: loss of control, compulsive use, and negative consequences. Right? One of the things I do when I handle this is to help users, those who are dependent, calculate the cost of the habit. The cost. Now, Sammy, we do this a lot. Let's explain it to our listeners. When we say the cost, is it just the cost of a roll of weed, or the cost of a tot of whatever, right? When we want people to lift themselves out of this pattern of problematic behavior, how can we help them compute the real damage, the real cost of the habit?
Great. I think it's one thing that we look at anytime that we are attending to people with problematic substance use or behavioral problems. So how do you calculate your cost? You calculate your cost based on the amount of money that you put in it, based on the time that and energy that you also put in it. Look at it, how it's affecting your productivity.
The car that you smashed,
the
interview that you missed,
exactly. And then your own personal upkeep. Now you don't even keep yourself as you used to be. There are things in the house, family problems start setting in. You don't take care of your family again. Your responsibilities and everything are no more being done as they used to be. And family and friends start to complain.
So it compromises relationships.
Your relationships. So it's a multifaceted element that you have to put into it to be able to assess yourself. Okay, fine, this is the amount of damage I'm doing to myself. It's not about your physical health alone, but your resources that you also put in, how much you have expended all these years because of your use of a substance or a particular behavior like the gambling, the soccer bets, and whatever that you are involved in.
Great stuff. I once handled a case of a teacher who was employed in the peri-urban, almost rural areas in a school. It was when he was transferred to Accra that he got involved in betting. To the extent that he owes so many people at work and around work, and his wife has left him and taken his 2 young sons with her, and has denied him access to his children. Now, when he talks about this drives him up the wall, right? I don't want to use the word crazy, but he definitely traces it to his entanglement with problematic gambling. Lorna, we're talking about the impact, okay? And we also talked about addictive behaviors, not just substances, so that people can see the whole spectrum, right? Are these the kinds of things that are presented to us?
Yes. So we have seen instances of what you described as pathological gambling.
Right.
In the instance where the gambling affects all aspects of your life.
You've lost control of
You've
it.
lost control of it. So it even propels you to now steal. You've lost control of your family life. You've lost control of your social life. No one wants to engage with you because there's no guarantee that they go home with what they came with when they were coming to see you.
Right.
And then there's also the personal aspect of your life where now you don't even have any money to look after yourself. So there are other instances, like you said, they are not too common, but we like the compulsive shopping.
Right.
Then there's also, of course, internet gambling, the internet porn. There have been episodes of compulsive gaming, stuff like that.
Right.
These are instances that come into medical care.
Great. Okay. We are not importing them. We are not downloading them. They're happening and they're damaging lives as we sit and speak right now. If you've just joined us, it's 22 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. With me, Nortey by nature. I'm in the studio with my colleagues. Dr. Lorna Latte is a resident with the Department of Psychiatry in Kolebu, and so also is Sami Dano is a mental health practitioner and a specialist when it comes to addictive behaviors and addictive or substance use disorders. If you have any questions, concerns, confessions, you can share with us on 055 11 11 997. Shortly, I will activate the phone lines. So we've done justice to the problem. You've gone over the edge. You've tried to pull yourself together. You've tried to shake it off, right? It's become like your shadow.
Sure.
You cannot run faster than your shadow, right? Like I said last week, the Chinese say, first the man takes the bottle, and then the bottle takes the man. So you are not in charge. Whatever habit we're talking about, okay? Irrespective of whether it is an over-the-counter medication or prescription, we have a lot of health professionals who have substance use disorders.
Yes.
Okay, so it's no respecter of persons. So please, we are doing this dispassionately, and we want to get into the business of how to help these people. Blessed Sunday, Nortey, and thanks for the intro selections this afternoon. Hey, Sarah Manfo in Winnipeg. I like it when people write inside Winnipeg. Just say, it's going on. All right, Sarah, thanks for tuning in, and share with us if you have anything to share by WhatsApp, 055 11 11 997. Right, so we've looked at this part of it, right? Clearly from our explanation, something is happening to your brain due to a chemical, right? And we're saying that these same mechanisms, this switching on of the brain's pleasure or reward centers occurs when you are engaging in addictive behaviors as well, all right? So the same way you might start with a little beer, right? You might start with some very innocuous soft pornography. Now you are not accidentally, but intentionally looking for hard porn, right? You've been hooked, and the soft one doesn't thrill you anymore, okay? And it may damage your relationships or your expectations of relationships or your ability to even engage in what is normative, should I say, sexual behavior. That's what we're talking about, right? It's broken the pot, right? It's bigger than the pot, and you need help. Okay, so when we come to this point where people need help, what kind of presentations are we typically getting? Are people coming themselves? Is it relatives, significant others, partner, and so on and so forth? Parents? Who's bringing who? Or is it a whole mix?
Okay, go.
Well, it's the whole mix. But I guess the commonest we see are people who are brought in by others.
Okay.
We discussed denial earlier.
Right.
So, of course, if you're in denial, help-seeking behavior it's not going to be likely.
Okay.
So, in the end, what happens is family members, significant others, friends end up trying to threaten the person.
Okay.
I mean, if you have something valuable in your life that you know you're going to lose, they can use it to push you into seeking care.
All right.
But generally, the voluntary visits, we do have a few where people generally calm themselves and realize that I do have a problem and I need some help.
Okay.
But the majority are people who are brought in by family. They are coerced and and light and well, I don't want to use the word light, but they are coerced and
Tricked
pressured.
into
They are
coming for help.
tricked to coming into hospital
Okay.
generally.
All right. Let me tackle this question, Sammy. I mean, I know there are different forms of therapy. There's medication or pharmacological help. There's behavioral programs and all that. But before that, how should a typical significant other, friend, work colleague, family member relate to or try to contend with this denial and resistance? This is somebody you care about. This is somebody you're close to or related to. They have a problem, and all the telltale signs we're talking about are evident.
Sure.
But they are not with you, whether it is going to church to talk about it or going for professional help, therapy, and management. Many families are at that point. They don't know what to do. Some bring in the security and the police to do the booga booga. How should a family do this? And do we, have the capacity or the resources to go out and help them bring somebody, in quotes, under compulsion into therapy or treatment?
Yeah, so we've had cases where it was difficult for the family to turn the person into the rehab or come to the facility for treatment.
All right.
So what you have to do, if you realize that your ward has a problem or a family has such a problem, you need to come to any of the psychiatric hospital and then report it to.
It definitely has to be a psychiatric facility.
Psychiatric facility.
Okay.
Because it's a mental health issue actually. So with that, they are going to help you when there is a counselor available. The counselor will now take over and then try to convince the individual by putting the cost of his behavior before him, and then try to reason with him to have a plan in order to get him recovered. Okay. Now, if this fails, then the other one is what you just spoke about, that compulsively or maybe forcefully we have to get a person to the rehab, because at that point they are no longer thinking for themselves. Right. So it's a substance that is thinking for them. And they can do anything to themselves and they become harmful equally to the society. Okay. So when they get to that level, the police can come in, or we have the psychiatric emergency team that equally are set up to go to these homes and bring this individual to the hospital. Okay. And then they go through the process of treatment before they go to the rehab.
Wow.
Another thing I wanted to add was we have the legal route you can go through as well.
Okay, really?
So because addiction or dependence is a mental illness, you can seek legal help in the form of a court mandated rehab. Right. Okay, so that one you have to go through the law courts to try and get an order to push this person into care.
Okay. All right, great stuff. As Sammy was speaking, Sammy, you may not recall, we had a typically a challenging one. We had to do some night SWAT with a very big macho patient.
I remember.
A client who gave us a lot of challenge, and at the end of the day, we had to subdue this chap right in front of what is now the Jubilee House. Oh boy, But later he came round and he thanked us for it. But, at a point, it was resistance and denial of the worst kind. Sure. Let me activate the phone line 0302216541. Ultimate Health on Joy 99.7 FM. We're looking at the phenomenon of substance use and addictive behaviors and their impact on your mental health and your mental well-being. My guest in the studio just heard speaking, Sammy Jando of the Department of Psychiatry, Kolebu, and Dr. Lorna Latte. I just got a message from our colleague, Dr. Grace Uswabuaji. She's unable to make it today. So she sends her apologies. It'll be good to, get her perspective on this as a clinical pharmacist as well. Okay, so if you have any questions, concerns, my phone line is active 0302216541. We're live on Facebook. YouTube is in withdrawal. But shortly I will activate the phone lines. But they're active now. Please note, and your guests, is it true that negative addictions can be fed from spiritual means? And how do you get rid of such stepily? Hey, Dagati in DC. All right, some spiritual terms there, steppily. All right, but well, is there anything spiritual? You know, Africans
Yes.
love this, and
Yes.
they'll bring it into the mix.
That is the issue.
They'll bring it into the mix. Okay, so is there any relationship spiritual?
Actually, we will be talking as scientists, so it will be difficult to say this has a spiritual cause and for that matter. But you see, because maybe a spiritual way of getting the person clean has to do with speaking to the conscience of the individual.
Okay.
The probability that by speaking to the person and then going through our rituals of religious
So
rituals.
some of those things may have psychotherapeutic ingredients.
Just as because even at the rehab centers, we don't leave spirituality out of the treatment.
Okay, we'll come to that in a second. Hello, good afternoon. Yes, who am I speaking to? Could you say that again? Matthias.
Yes, Matthias.
All right, please share with us quickly.
Because the one
Oh, Matthias, I think there seems to be a problem with your line. Try and call again and let's see if we can get a better connection, right? Matthias is trying to share something, but I can't hear him. So if you have any questions, concern 032221 6541. Those are the buttons to push. I hope Matthias gets back to us. So, okay. So some people bring in the spiritual spin. Indeed, when you look at one of our group processes, the 12 steps.
12 steps, yeah.
Right. Alcoholics Anonymous, AA, Narcotics Anonymous, and so on and so forth.
Yes.
It does have a religious or spiritual backbone.
Yes.
Okay. Is that to leverage the belief systems and the mind of the person, or is that to say, like the question was put, that there is a spiritual component?
No, it's a form of CBT, cognitive behavioral therapy.
Somebody will say you are blaspheming. But go ahead.
Yes. So what we try to do is to let you understand that it's about your willpower.
Okay.
You are submitting your willpower into the hands of something bigger than you.
You've lost your control.
Your control.
So you need a greater
that is the point.
supreme
being. So in one of the books, somebody wrote that his supreme being or his willpower or his let me say, it's the doorknob.
Okay.
Anytime he gets drunk, it's the doorknob that helps him to be able to get up.
Okay.
So now it now becomes his higher power.
So you
that
can
is it.
leverage a person's
That is the point.
faith.
That is the point.
Right.
That is the
To
point.
help them.
To help them come out what they
Okay.
believe in.
I hope my listeners understand that and we don't get it twisted, right? There are various modes of intervention.
Yeah.
Okay. And that's what we're talking about. If you have any questions, concerns, 0302216541. Okay. So Sammy and Lorna, I confess.
Sure.
Charlie, it hasn't been easy. I need help.
Okay.
What are the steps? How does one get help? Okay. And does my confession suffice, or does there need to be a detailed assessment and so on and so forth?
Sure.
So you've admitted to yourself that you need help. So now the first thing you do is to seek help. So when you come into a health facility, the first thing we need to do is assess what the problem is.
Okay.
How badly you need help and what kind of help you need.
Right.
And then
Just a sec. So let's say I'm doing some regulated or illegal substance, and I come and tell you, Sammy and Lorna, what you guys gonna turn me in? I mean, these are the kind of nuances I want us to be very practical, so people can come forward, right? This is my problem. I want to get out of it.
Yeah. So with this aspect, not everyone that comes to us will go to the rehab.
Okay.
But it can equally be done with the help of a specialist,
Right.
and then at home.
So you could be coming as an outpatient.
As an outpatient.
All right.
Or when we realize we have assessment tools that we use.
Okay.
And when we assess you and we realize that no, you need brief intervention, we just tell you the facts on the ground, let you understand the cost of it, and then the next moment we try to draw up a plan for you to be able to put up a behavior that is not deleterious to you.
Okay.
So that is an aspect of it.
Right.
And then the other aspect is when we realize that you have gone too far and the scale that we are using to measure you, then we think that, okay, fine, you need a break from the society for a period of maybe a month or 3, so that you are going to now relearn behaviors without the use of the substance, and then you come out.
Great stuff. Let me come back to you, Lorna. So you were explaining before I asked the part about
The
whether I can trust you guys in your
Sure.
intervention.
So, as health workers, as doctors, we have confidentiality. Yes, there's a confidentiality relationship that we have with you. So, ideally, when you walk into the clinic
Right.
and you are using illegal substances and you have come to seek help from your addiction or dependence,
Okay.
my first place is to try to get you the help that you need.
Okay.
So I'm not compelled immediately to go and see him.
All right.
Yes.
Okay.
So you are that relationship. We have that relationship unless there's a legal issue that requires me to break this confidentiality.
So we need this user. We need this person who is engaging in maladaptive, harmful use to log on.
Yes.
Right. So we don't want to be doing things that will get them
Yes.
to switch off.
To switch off. Yes.
All right, great stuff. Great stuff. Okay. Again, your questions, your calls are welcome. So, yeah, I come to you and we're starting a process. Okay. You guys have taught me about withdrawal. I've come to you to seek help. You are assessing me to embark on the journey of intervention, treatment, management. Okay. Does that automatically delete all the softwares I have downloaded, and therefore will I be free automatically and immediately of withdrawal and the cravings? How do you manage that? Whilst I'm in therapy with you, I experience these cravings. The drug, the behavior, or the whatever is calling me, right? How do we manage that?
So the medical definition of addiction is that it's a chronic, compulsive, relapsing brain disorder.
All right.
So what that means when we start with chronic, we mean that it's generally lifelong.
It's long term.
It's long term.
Right.
So yes, you came in seeking help, and now you are ready to stop. You have stopped using substances.
Okay.
But the chronicity of it means that you will still have these. Even if you don't have the physical dependence where your body, you no longer feel ill when you don't have the substance.
Okay.
You still have these continuous mental cravings, mental wants of the substance that you are using.
Okay.
So the whole point of recovery is to help you deal with these psychological issues, these compulsive cravings that you have.
All right. Okay, I have a caller on the line. Hello.
Hello. Good afternoon.
Hi, good afternoon. Who am I speaking to?
You are speaking to KK.
KK.
Yeah.
You're welcome. Share with us.
I have a junior brother who is addicted to gambling. And he won't accept his fault. He won't accept that he has a problem. How am I going to go with this?
Okay. So he's talking about what sounds like pathological or compulsive gambling. A junior brother, he won't accept. Right. What kind of help can we give KK?
So I think we outlined it in earlier on as seeking help from the experts from the psychiatric institutions.
Right.
So or you can see any of the rehab facilities in this country who are certified addiction professionals.
Right.
So for them, they are going to now speak to the individual to be able to assess him, his level of use or his level of behavior that is being problematic.
Gambling.
Then they will now step in to help.
Right.
If it's becoming too difficult, that he still do not accept, but it's becoming a problem for the family himself and even the society as a whole, then what Dr. Latte talked about as seeking court order, treatment order from the court would be the best, so that we can get him into the rehab to be able to relearn a better way of life.
Okay, right. That's a good answer. But let me bring this in as well.
Okay.
We face this all the time. We need to talk facts on the ground. So you become a problem, and this in this instance is related to gambling. So the family gradually over time is not pleased with you. There's a lot of negative bashing, there's a lot of labeling, there's a lot of judgment, right? So whilst you would bring in the primary target, which is the young man who is gambling, what kind of support do we give family? Because they say, Charlie, we know him. Oh, you people, you think he has changed. Just yesterday, he went and came, right? What kind of support, right, do we give to make sure that the social envelope in which this person lives and operates is also modified in the right direction?
Yes. So honestly, it's a big problem when we have that. And generally, the family tends to feel that they don't want to deal with this person anymore.
Okay.
And they're not interested.
Lorna, let me just take this call and hold on to that. Hello, good afternoon.
Hello, good afternoon.
Right, who am I speaking to?
My name is Sam, please.
Samson.
Sam.
Okay, please go ahead, Sam. Shoot.
Yeah. I wanted to contribute, but made a point concerning how the private rehab centers are being run. I happen to have stayed in one. I'm not going to mention the name.
Okay.
I was hooked to alcohol, and that was what sent me there. I stayed about 2 months there.
Okay.
Although I didn't have serious issues, but it came to a point I realized I couldn't stay away from liquor, so I just had to check in myself with my sister's help and my wife so that I could take time and recover. What I realized was where I went, they don't have an in-house doctor.
Okay.
Or even a psychologist, a professional psychologist or something.
All right.
So it was, I think, inmates that have gone through the system were those who were lecturing us and taking us through the daily process.
Okay.
And sometimes, some people are hooked on serious drugs. And instead of sending them to the asylum, they bring them to the rehab, and those people are violent. And we are crowded in the same area with such people. And sometimes it gets worse to the extent that the caretakers actually assault the inmates physically to the extent of hurting them. I got scared one time. I decided that when my sister comes over, I'll just tell her I'm checking out because of the abuse of. I didn't not one, not twice, about 3 different times.
Right, Sam. Let me ask, if I may, and thanks for sharing this. How are you doing now?
I'm doing good.
Right. Are you still having challenges with alcohol?
Not for now, but initially when I came out.
Okay. So
when I came out, I started again. I started drinking again. But for now, for almost about a month or getting to 2 months now, I've stayed clear.
All right, Sam, I'm going to ask you to, if you don't mind, you give your number to my producer, Abeku, right?
Okay.
And then we'll discuss the problem you have raised, okay?
Mm-hmm.
A month clear in the journey we're talking about is really nothing, right? Mm-hmm. Though it is some progress, okay?
Okay.
You need a comprehensive program and an assessment. But your point is that there are some privately run rehab centers where there's no regulation. They don't seem to have the full complement of qualified professionals, and indeed, in some regards, some level of abuse takes place there, which further damages the people who go there for help. Right. Yeah. Another thing you raised, and I'm bringing it up to Sami and Lorna. Very often there are centers, whether they are attached to public facilities or not, that have recovered addicts, if I can use that word. I don't like addicts, but recovered persons who now are able to share. And there's a lot of peer counseling and processes that take place. Okay. But this is the problem KK, no, this is Sam. Sam has shared with us, right? Concerns about private facilities and the conditions and who should be running them and who should be checking them.
Yeah, I think the operations of the rehab centers are under the Narcotic Control Commission.
Okay.
So they are the key regulators for these institutions. And then also the Mental Health Authority
Right.
is also responsible to be doing checks on these individuals or private institutions.
Okay.
And we must admit that we don't have too many of addiction specialists in this country.
Right.
So there are people who are in recovery,
Right.
who have also undertake the program,
The training program.
the training program, and then now running their own private
And
facility.
therefore, they do have some degree of qualification.
That's
right.
the point. But we always advise that at least come to the mainstream facilities like the Kolebu, the Cross Psychiatric Hospital, the Pantine, so that experienced individuals will be able to handle you and put you in a private facility that is trusted, or even in the government facilities that are available.
Great stuff. And you must know that some of the treatment does involve the administration and the use of medications. You need qualifications to be doing that.
Yes.
And if the persons who are handling the center are not qualified, all sorts of all manner of things could be going on, right? Or they probably try to manage you without the needed medications as well. Lorna, any comments on that?
Well, that's true. With addiction comes some psychiatric issues which might require medications.
Right. Okay.
So ideally, that's why you need to be assessed by a doctor if you have addiction issues, to be sure that you don't have any comorbid mental illness with the addiction or dependence that you have. So that if you do, we can put measures in place to help your recovery with addiction. Because the problem is, if you have comorbid mental issues and you go into a rehab facility, it's not likely that the rehab will be effective.
That's right. Okay. Okay, great stuff. And mind you, some of the withdrawal states, when you go into withdrawal, are physically considered medical emergencies.
Yes.
Right? Yes. So if you are withdrawal, you need a trained person to handle that physiological withdrawal.
Yes,
okay? And many people lose their lives in these transitions. Okay? And so you do have to have qualified persons handling your journey, right? Sure. Be it detox, be it rehab. Okay? Now, today, dear, your Buckingham Palace English Campa, a program flooded with vocabs. I have learned a lot. Thanks, guys. This is Dagat in DC. You two, you wrote steppily. That one, is it Buckingham Palace or Garmanchester Palace? Great stuff. Good to know you are tuned in. We have about 10 or 11 minutes left. 0302216541. We're talking about substance use and addictive behaviors and their management with the mental health specialist Sami Jando. Is a mental health practitioner and addiction specialist, and of course Dr. Lorna Latte is a resident with the Department of Psychiatry. We're doing this as part of our extensive focus on mental health issues, which we seek to prioritize. Right? The new wealth is mental health. Right. Great stuff. Good afternoon, Nortey and the professionals. Please, I have been on phenobarbital, folic acid, and carbamazepine. That's Tegretol, right? For over 3 years to deal with seizures. So we're talking about epilepsy here. Of course, we need to know whether these seizures are induced by a substance. But anyway, please, what could be the side effects and what must I do? This is Aite in Bubuyashi.
So the best thing for Aite to do is he has to go back to his doctor who put him on phenobarbital, folic acid, and carbamazepine and discuss why he's on that medication and what the side effects are. Okay. The last part about what I must do, I'm not too clear.
He's worried about side effects and if he can do something. Okay. But definitely he's on medication. Yes. Prescribed. Yeah. Yes. Okay. Maybe you can touch on this. Sometimes once given a prescription, our clients feel they don't need us. They just continue the prescription. They don't go or they don't present for reviews. Right? Nobody's monitoring. This seems to be a seizure disorder, which needs to be properly assessed and classified. If it's epilepsy, it's one thing. If it's a drug-induced Seizure, it's another thing. So I think he needs to present for assessment.
Yeah, he needs to present for an assessment to see.
All right. Some people feel once they know the names of the drugs, they keep on
No.
buying, and therefore now 3 years. You send us a message if there's been a review. Let's see what you've been told. 2:51 is the time. We have about 9 minutes to checkout time. So these are practical management issues. Okay. Let me ask the big question that most people ask. So is this something that can be, let me use the African, cured? All right. Can I shove this out of my history and lock it up somewhere, throw away the key, or do I have to be dealing with this and be vigilant about my interaction and entanglement with substances on a regular basis? In the AA processes, you always introduce yourself as a recovering addict. You never call yourself fully recovered. It gives you a healthy vigilance when it comes to substances. Can we cure this?
Okay. With substance use disorders, we don't have a direct cure for it, but it can be treated and managed for the rest of your life.
Okay. Africans don't like the word or the term or the phrase management.
Yes.
Dr. Ben,
So we will be able to empower you to the extent that you will be able to stay independent of any substance or any behavior that is addictive in life.
We're heading you towards a substance-free
life that you are going to maintain for the rest of your life. There are people who have been in recovery for over 50 years, 25 years, 30 years, meaning it's possible to stay without the substance, because we believe that when we tell you that one is many and then many is never enough, we mean that don't touch it at all. Anytime you touch it, there will be a relapse. That's why it is chronic relapsing brain disease. So it doesn't have a cure, but people have stayed without the use and then they are better in life.
Great stuff. You need help. You can't do it on your own. And indeed, with some of the substances, there are many other collateral forms of damage. There are women who drink during pregnancy. We have fetal alcohol syndrome. There are people who now have HIV because under the influence of something, they could not engage in what we call safe sex or safer sex, and so on and so forth. In fact, when you look at the horn, no, it's not, the lower parts of Africa, East and Southern Africa, their HIV rates are, high, and some people have, researched and linked it with substance use and so forth. So please, there are various other forms of collateral damage that if you engage in a program, you become aware of, and you become more engaged and vigilant about protecting yourself and your loved ones. If you have any questions, concerns, we're still live and direct in Joy 99.7 FM, Ultimate Health. Good afternoon, Nortey. I'm listening and learning as usual. This is Linda in Osu. Charlie, Linda, long time. Oh, Charlie, great to have you on. This one says, I want Nortey's number. Unless you're sending me Momo, I don't get this. How do we do consultations, please? What number do we call? Sammy, do we have a department number? And then the person says, hi, I want Nortey's number. I got your number. I'll contact you, right, and see what kind of help you need. If we want to get in touch with the Department of Psychiatry after, prioritizing mental health, people now want to get in touch. How do they do that?
So we have a number available.
Okay.
So I'll mention that right now. So that's 0302 908 983.
Okay, once again.
0302 908 983.
Okay.
That's the number for the Department of Psychiatry OPD.
Okay, that is our outpatient department.
Yes.
So when I call this, it must be picked up.
Yes.
It will be picked up.
Ideally from 8 to about 4 or 5, it will be picked up.
Okay,
yes.
So this is a general OPD number. Give it again, Lorna.
0302 908 983.
Okay. Now, when I get through on this number, I'm speaking to the general OPD.
Yes.
So do I go straight off and start confessing and telling you my problem? Or what's the process? So
ideally, when you call this number, you'll be speaking to a health worker.
Okay.
Yes. And then you can address whatever issue you have. So ideally, you could ask you could address what issue you have, and you'll be
Okay.
directed the best way it can be. So if
Okay.
you need to come in,
Right.
when you can come in, or how we can help you, or who
Right.
you
You'll
need
be
to talk
scheduled
to.
some kind of appointment
Yes,
for
please.
an assessment
Yes.
and some consultation. Okay, great stuff. Give the number again.
The number is 0302 908 983.
Okay, I know we have an addictive diseases unit, a center where we do a lot of work, right, on the individual and on group basis. A lot of these AA and other meetings go on there. Sammy, briefly, just give us a word on what goes on there.
Yeah, so the addictive disease unit also sees cases which have which are addictions
Right.
in nature.
Okay.
So what they do is they organize weekly meetings.
Okay.
So in a week you can come like 3-4 times in a week.
Okay.
And then you'll be taking through some processes that is similar to the rehab centers.
Okay.
And then with that you'll be able to they will also keep an eye on you and then be monitoring you whilst you are in recovery.
Okay.
So it's a clinic on its own,
Right.
that people get help
Okay.
in that.
Okay.
Yeah.
So you're attending group sessions, learning about your body, learning about the substance and
Yeah.
its impact,
Yeah.
right, alongside other people who are entangled with substances.
Exactly.
Okay. What's the benefit of doing this in a group as against one-on-one?
So by sharing your experiences
Mm-hmm.
among the groups, you are also able to learn from others who have even more difficult situations than you have. There are people who have lost it all. So it's a source of motivation for you to stay in. And then the number of years people have equally been in recovery also encourages you that indeed you can do it.
Okay.
So sharing problems helps each other to be
They'll
able
share
to
with you when they relapsed, how they struggled,
how
and
they
all that.
struggle
So
and
you
how they
learn.
manage their cravings,
Okay.
and how they are able to mingle well with the society
Okay.
as a non.
All right. Douglas in DC says I didn't wish him happy birthday. Oh, Douglas, happy birthday. Why? What is this about my own blood donation? I should donate blood because I didn't wish you. Ooh. All right. This is Douglas in DC. Happy birthday to you. All too soon we have to wrap up. We'll probably bring other colleagues into the studio. But Lorna, what do you want to leave our listeners with when it comes to substance use?
We were talking about the family and the social aspects, I think, before you go a call, and how family members feel there's a break in relationships between family members because of addiction. What I would have to say is that part of the recovery is also healing the family.
Okay.
Because a recovering addict cannot go back into a broken family.
Okay.
It is a way for the person to fall back or relapse
Okay.
into problems.
Right.
So part of recovery includes healing families.
Okay.
Yeah, that's
All
what I
right.
want to
So we're dealing with the whole network.
Yes, it's a unit.
It's a unit.
Yes.
The person in the family and the
Yes.
family as well.
Yes.
Okay, Sammy.
So we believe strongly that addiction is a mental health problem, and it is not a moral problem that people will think that, yes, because you are morally inclined, that is why
Okay.
things are like that. So you should seek help.
Okay.
And the fact is, it dwells in secrecy. So if you don't reveal it, you will never get the help.
Great stuff.
We are available to help you anytime. You can call us, and then we'll be able to attend to you in any way that
All
we can.
right. Let's hit that number again, Lorna.
0302 980. Sorry. Yeah, 030 908 983. 0302 908 983.
Okay, great stuff. And we're indeed grateful to the two of you and indeed the whole team that's been with us over the past couple of weeks. And we'll do our best to prioritize mental health on Ultimate Health, right, and bring in a couple more of those issues and empower our listeners. Once again, thanks to Sami Jando of the Department of Psychiatry and also Dr. Lorna Latte for educating us when it comes to substances. All right?
Thank you.
So, hey, I know you're addicted, but we got to go. Go into withdrawal for about 6 days. On the 7th day, we'll be back with another healthy, easy to digest edition of Ultimate Health with me, Nortey by Nature. Coming up next, another edition of our special Joy FM mini pop quiz. We have 4 young kids coming in to vie for the opportunity to run off to Singapore. I think one of them will get to go to Singapore. When I won't go. Stay on Joy 99.7 FM.